poor sense of smell is quietly erasing memories across America, and almost nobody is connecting these two things. Right now, millions of people over 60 are losing their ability to smell coffee in the morning or flowers in the garden, and they think nothing of it. But here is what your doctor is not telling you. That fading sense of smell is one of the earliest, most reliable warning signs that Alzheimer's disease has already begun to take root in your brain. Not years from now, right now. And the window to act is closing faster than you think. Before we go any further, stay with me until the end, because the number one signal I am going to reveal today is so specific, so precise, that a major study out of the University of Chicago found it predicted Alzheimer's diagnosis with over 80% accuracy years before any memory test could catch it. And yet almost no one talks about it. Almost no one tests for it. Your brain is sending you a message through your nose, and today you are finally going to learn how to read it. I am Dr. Patricia Holloway, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have worked with thousands of men and women over 60, watching them lose pieces of themselves to cognitive decline. And I have seen firsthand how the earliest signals are almost always missed. What I am about to share goes against what most people assume about Alzheimer's. The medical establishment tends to talk about memory loss first, but I have seen it with my own eyes, patient after patient. The nose knows long before the mind forgets, and I refuse to stay silent any longer. Here is what is happening inside your brain right now and why this matters so deeply. The olfactory system, the network of nerves responsible for your sense of smell, is directly connected to two of the most critical brain regions affected by Alzheimer's disease: the hippocampus, which controls memory formation, and the entorhinal cortex, which is often the very first area where Alzheimer's damage begins. When toxic proteins called amyloid plaques and tau tangles start accumulating in the brain, they almost always hit the olfactory pathways first. This is not a coincidence. This is biology giving you an early warning system. A landmark study published in the journal PLOS One followed over 2,000 adults for 5 years. Those who struggled to identify common smells were significantly more likely to develop Alzheimer's and other forms of dementia. Another study from Rush University Medical Center found that people with the lowest smell identification scores were more than twice as likely to develop dementia within the following 12 years. 12 years. That is 12 years of opportunity to intervene, to protect, to slow the process, if only someone had paid attention to the nose first. And here is what terrifies me most. Most people dismiss this symptom entirely. They blame it on aging. They blame it on allergies. They blame it on an old sinus infection. And by the time memory problems become obvious, critical years of intervention have already been lost. Before we continue, I want to ask you something. Are you in your 60s, 70s, maybe beyond? Have you noticed that food just does not taste the way it used to? Or that you cannot smell a candle burning across the room the way you once could? If that sounds familiar, type "nose" in the comments right now. You are not alone, and what you are experiencing deserves serious attention. Now here is the important thing. There is not just one smell signal your brain sends. There are several, and they appear at different stages with different levels of urgency. Today, I am going to walk you through the 7 most critical smell-related warning signs of Alzheimer's and cognitive decline, ranked from the least alarming to the most urgent. By the end of this video, you will know exactly what to watch for, what to tell your doctor, and what you can do starting tonight to protect your brain. Let us begin. Sign number 7. You need things to be much stronger smelling than before to notice them. This is called reduced odor sensitivity, and it is often the very first change people experience, sometimes as early as a decade before any memory symptoms appear. You used to walk into a kitchen and immediately smell dinner cooking. Now you have to stand right over the stove. You used to smell rain coming before it arrived. Now you barely notice it when you step outside into it. After 60, some reduction in smell sensitivity is considered normal. But there is a difference between mild, gradual reduction and the kind of accelerated decline associated with early neurological change. Research published in the Journal of Gerontology found that adults who experienced a sharper than average decline in odor sensitivity over a 5-year period had a 47% higher risk of developing mild cognitive impairment compared to those with stable olfactory function. The mechanism is straightforward. As amyloid plaques begin accumulating in the olfactory bulb, the brain structure that processes smell information, the signal from your nose to your brain becomes weaker. It is like static on a radio. The station is still broadcasting, but the reception is getting worse. Most people assume this is just aging. It is not always just aging. Pro tip here: pay attention to whether the change is happening in both nostrils or just one. Bilateral decline, meaning both sides equally, tends to be more associated with systemic neurological issues. Asymmetric decline, meaning one side faster than the other, can sometimes be structural, related to polyps or sinus issues. It is a distinction worth discussing with your doctor. Sign number 6. You frequently mistake one smell for another. This is subtler and often overlooked entirely. You smell something burning, but it turns out to be someone's cologne. You think you smell a skunk outside, but nobody else can detect anything unusual. You put milk to your nose and it smells slightly off to you, but it is perfectly fresh. This phenomenon is called parosmia, which means distorted smell perception. And while parosmia can happen for various reasons, including certain medications and viral infections, when it appears alongside other cognitive symptoms or emerges gradually without a clear external cause in someone over 60, it warrants serious attention. A 2021 study published in Frontiers in Aging Neuroscience found that olfactory distortions, not just loss, but distortion of smell, were present in a significant percentage of early Alzheimer's patients before formal cognitive decline was detected on standard testing. The brain's ability to correctly interpret smell signals requires intact neural architecture. When that architecture begins to deteriorate, the interpretation becomes unreliable. You are not smelling a skunk when there is none. Your brain is misfiling the information it receives. This is where most people go wrong. They assume they simply have a quirky sense of smell. They laugh it off. But if you find yourself regularly misidentifying smells that other people around you identify correctly, that is a signal worth taking seriously. Sign number 5. You can no longer smell your own body odor reliably. This one is delicate but critically important. One of the roles of our olfactory system is self-monitoring. We subconsciously regulate our hygiene in part because we can smell ourselves. When this self-monitoring begins to fail, people may stop noticing when they need to bathe, when their clothes carry odors, or when their breath has changed. Families often notice this before the person does, and it can be an early and distressing sign that something neurological is occurring. A study from the Harvard Medical School Department of Neurology found that impaired self-smell monitoring was correlated with early changes in the entorhinal cortex, the very first brain region reliably affected by Alzheimer's pathology. If you have a trusted family member who has gently mentioned hygiene concerns that are uncharacteristic of you, please do not dismiss it or take offense. It may be one of the most important conversations of your life. Sign number 4. You cannot identify smells when you know you should be able to. Let me ask you something right now. If I put a fresh lemon under your nose, would you recognize it instantly? What about cinnamon? What about gasoline? These are what researchers call high familiarity odors, smells that healthy adults recognize almost instantly without having to think about it. There is a standardized test used in research settings called the University of Pennsylvania Smell Identification Test, or UPSIT. It involves scratching a series of panels and identifying the smells. Studies using this test have consistently shown that performance below a certain threshold in adults over 60 is a powerful predictor of Alzheimer's disease within the following 5 to 10 years. A major study published in the Archives of Neurology followed 589 older adults over several years. Those who scored in the lowest quartile on smell identification tests were 150% more likely to develop Alzheimer's than those who scored in the highest quartile. That is 2.5 times the risk, identifiable through something as simple as trying to name a familiar scent. Here is a simple, informal self-test you can try right now. Go to your kitchen, close your eyes, pick up cinnamon, coffee, vanilla, and an orange. Have a family member hold each one under your nose without telling you what it is. If you correctly identify all 4 instantly, that is reassuring. If you struggle with 2 or more, that is worth discussing with your physician. Not to panic, to act early. I want to tell you about Margaret, a 74-year-old retired schoolteacher from Philadelphia. She came to my office because her daughter was worried. Margaret had become increasingly dependent on very strong-smelling foods. She was adding enormous amounts of garlic and spices to everything she cooked. Food had become bland and uninteresting to her, and she could not understand why. When I tested her smell identification, she failed to identify banana, cinnamon, and soap. She identified paint thinner as licorice. Her daughter started crying quietly in the corner of my office because she had already suspected something was wrong. We ran further testing and discovered early-stage Alzheimer's pathology on imaging. But here is what matters. We caught it early. Margaret started on a comprehensive protocol including specific dietary changes, omega-3 supplementation, targeted exercise, and sleep optimization. 2 years later, she is still living independently. She still teaches Sunday school. She told me, and I will never forget this, she said, "Doctor, I thought I was losing my mind. Instead, I found out my nose was trying to save it." This was not luck. This was early detection doing exactly what it is supposed to do. Sign number 3. Your sense of smell fluctuates unpredictably from day to day. This is one of the more confusing and underreported warning signs. Someone experiencing early neurological changes may have days where their smell seems completely normal, followed by days where it seems almost entirely absent. This variability can actually make people less likely to seek help, because on the good days they reassure themselves that everything is fine. But this fluctuation itself is a significant warning sign. A healthy olfactory system is generally consistent. When smell perception begins swinging dramatically from day to day without an identifiable cause like allergies or a cold, it suggests that the neural pathways responsible for smell processing are becoming unstable and unreliable. Research from the Mayo Clinic found that olfactory fluctuation, specifically the inconsistent pattern of smell perception rather than stable decline, was associated with what researchers called faster cognitive trajectory, meaning that those with this fluctuating pattern tended to progress more quickly once cognitive symptoms emerged. The unstable pattern may reflect ongoing active neurological disruption rather than a fixed structural change. If you or someone you love seems to have their smell ability come and go without explanation, that inconsistency deserves a medical conversation. Sign number 2. You have completely lost the ability to smell certain specific categories of odor, particularly food smells, while other smell categories remain intact. This selective smell loss is one of the most scientifically precise warning signs on this entire list. The olfactory bulb does not process all smells equally. Different types of odors are processed by different neural populations. Food-related smells, particularly complex food odors like cooked meat, fermented foods, and sweet-baked goods, rely heavily on olfactory pathways that connect directly to the hippocampus. These are precisely the pathways that Alzheimer's pathology attacks first. When someone begins to lose specifically food-related smell while still being able to smell things like cleaning products or gasoline, this selective pattern is neurologically meaningful. It suggests that the pathology is progressing along the hippocampal olfactory axis before it has spread more broadly. A study published in the journal Neurology found that selective loss of food odor identification in otherwise cognitively normal adults over 65 predicted hippocampal volume loss on MRI scans taken 3 years later, a direct structural marker of Alzheimer's progression. If you have noticed that food just does not smell the way it used to, that the kitchen does not fill with aroma the way it once did, that meals have become less appealing because they smell like very little, please take this seriously. It is not your taste buds. It is not your cooking. It may be your brain sending you its most important message. Now, before I get to sign number 1, I want to address something important. If you are watching this and recognizing several of these signs in yourself or someone you love, I understand this is frightening. But please hear me clearly. Recognition is power. An early conversation with your doctor, a referral to a neurologist, a simple smell identification screening, these are not sentences. They are opportunities. The earlier Alzheimer's pathology is identified, the broader the range of interventions available, and the longer the window of preserved independence and quality of life. If you believe smell changes can be an early warning sign worth paying attention to, type yes in the comments right now. If you are still skeptical, type 0. Either way, your response helps others watching this know they are not alone in what they are experiencing. Sign number 1, the most urgent warning sign. You cannot smell peanut butter with your left nostril, but you can smell it with your right, or vice versa. This sounds almost impossibly specific, but the science behind it is extraordinary. And this is the sign that I believe every adult over 60 in America needs to know about. Researchers at the University of Florida conducted a now famous study testing olfactory function specifically by nostril, one at a time, using peanut butter as the test odor. They found something remarkable. In patients with early-stage Alzheimer's disease, the left nostril consistently detected the peanut butter smell at a significantly greater distance than the right nostril. The asymmetry was directional, and it was specific to Alzheimer's as opposed to other forms of dementia or cognitive impairment. The reason is neuroanatomical. The left nostril connects more directly to the left hemisphere olfactory pathways, which in turn connects more directly to the memory centers most affected in the earliest stages of Alzheimer's. The right nostril connects differently, so when Alzheimer's pathology begins disrupting olfactory processing, it tends to create an asymmetry that shows up in this simple test before it shows up anywhere else. The University of Florida team found that this left-right nostril asymmetry identified early-stage Alzheimer's patients with an accuracy that outperformed several standard cognitive screening tools. They described it as potentially a cheap, fast, and reliable early screening test that could be done in any doctor's office in minutes. And yet, how many doctors are doing this test? Almost none. Let me tell you about James, a 71-year-old retired police officer from Chicago. His wife Susan brought him to see me after she noticed he had stopped commenting on food smells the way he used to. James had always been the one in the kitchen saying things like, "Is that rosemary chicken? I can smell it from the garage." That had stopped. He dismissed it completely. He said he was just getting older. In my office, I had James do the simple peanut butter test, holding a jar at arm's length with his right nostril blocked, then switching. The difference was remarkable. With his right nostril, he could detect the peanut butter from about 11 inches away. With his left nostril, he detected it from over 20 inches. A 9-inch asymmetry. We proceeded to full neurological evaluation. The imaging showed early amyloid accumulation in areas consistent with preclinical Alzheimer's disease. James was devastated at first, but then something shifted. He looked at me and said, "Doctor, if my nose hadn't told us, when would we have found out? When I couldn't remember my grandkids' names?" He started an aggressive early intervention protocol. Dietary changes, specific supplementation, structured cognitive exercise, optimized sleep, and regular monitoring. That was 3 years ago. James still goes fishing every weekend with his son. He still calls me by my first name when he sees me in the hall. He told me last month, "My nose saved my life. If you want to try the peanut butter test at home, here is exactly how to do it. You will need a jar of peanut butter and a ruler. Sit in a room with no other strong smells. Close your mouth and breathe normally through your nose. Block your right nostril completely with your finger. Open the peanut butter jar and start with it at arm's length, about 12 inches from your face. Slowly bring it closer, 1 inch at a time, until you first detect the smell. Note the distance. Then block your left nostril instead. Open a fresh jar or wait a minute for the smell to clear. Bring it in from arm's length again, 1 inch at a time. Note the distance again. In healthy adults, the difference between the two nostrils is typically less than 2 inches. A difference of 4 inches or more, particularly if the left nostril detects it later than the right, meaning you have to bring it closer to the left nostril to smell it, is a finding worth discussing urgently with your doctor. This is not a diagnosis. This is a signal. Take it seriously. Take it to a professional. Now let me give you the practical action plan, because awareness without action is just anxiety. If you recognized 1 or 2 of these signs, make an appointment with your primary care physician and specifically mention olfactory changes. Ask for a referral to a neurologist if they are not familiar with olfactory screening. Start the protective lifestyle changes I am about to describe. If you recognized 3 or more of these signs, please do not wait. Call for an appointment this week. Bring this information with you. Ask specifically about olfactory testing, cognitive screening, and if appropriate, brain imaging. Regardless of where you are on this spectrum, here is what the research says you should be doing every single day to protect your brain starting now. Number 1, omega-3 fatty acids, specifically DHA. The brain is roughly 60% fat, and DHA is its primary structural fat. A study in the Journal of Alzheimer's Disease found that higher DHA levels were associated with significantly larger hippocampal volume. Take 1,000 to 2,000 milligrams of high-quality DHA daily, with a meal containing fat for best absorption. Number 2, nasal olfactory training. This sounds unusual, but the evidence is compelling. Smell training involves regularly exposing yourself to 4 distinct odors, typically rose, eucalyptus, lemon, and clove, for 20 seconds each, twice a day. A randomized controlled trial published in Chemical Senses found that olfactory training significantly improved smell function in adults with smell loss, and emerging research suggests it may actually support olfactory nerve health more broadly. You are literally exercising the neural pathways connecting your nose to your memory centers. Number 3, Mediterranean-style diet. Study after study connects adherence to a Mediterranean diet with slower cognitive decline and reduced Alzheimer's risk. A landmark study in the New England Journal of Medicine found a 35% reduction in cognitive decline risk among older adults following a Mediterranean dietary pattern compared to controls. Focus on leafy greens, olive oil, fatty fish, berries, nuts, and legumes. Number 4, sleep, specifically deep sleep. During deep sleep, the brain's glymphatic system activates, essentially a waste clearance system that flushes amyloid proteins from brain tissue. Chronic poor sleep allows these proteins to accumulate. A study in Science found that even 1 night of sleep deprivation significantly increased amyloid accumulation in the brain. Target 7 to 8 hours, prioritize dark and cool sleep environments, and address sleep apnea if present, as it is significantly associated with accelerated cognitive decline. Number 5, exercise, particularly aerobic exercise that elevates your heart rate. Physical activity increases brain-derived neurotrophic factor, often called BDNF, which supports the growth and maintenance of neurons, including in the olfactory system. A 2022 study in the Journal of Applied Physiology found that consistent moderate aerobic exercise was associated with a 38% reduction in Alzheimer's risk over a 10-year follow-up period. Even 30 minutes of brisk walking 5 days a week begins to show measurable neurological benefit. Do not make these critical errors. First, do not wait until memory problems appear to address smell changes. By that point, years of intervention opportunity have already passed. Second, do not self-diagnose or catastrophize based on one sign alone. These signals need to be evaluated in context by a professional. Third, do not assume that Alzheimer's prevention is beyond your reach. The research is clear that lifestyle interventions can meaningfully slow and, in some cases, halt early progression. You have more power here than you have been led to believe. Within 1 week of starting this protocol, most people notice improved sleep quality and slightly more energy. Within 2 to 4 weeks, some people report that smell sensitivity has begun to sharpen, a direct sign of olfactory pathway support. Within 2 to 3 months, those who stick to the full protocol frequently report clearer thinking, better word retrieval, and improved mood. And within 6 months, brain imaging in research settings has shown measurable improvements in hippocampal volume and reduced amyloid burden in adults following comprehensive protocols like this one. You are not broken. Your diet, your sleep habits, and the information you have been given are what may be broken, and those are fixable. Let me quickly recap what we covered today. Sign number 7, needing much stronger smells than before to notice them. Sign number 6, mistaking one smell for another. Sign number 5, inability to smell your own body odor. Sign number 4, failure to identify familiar smells instantly. Sign number 3, unpredictable day-to-day fluctuation in smell. Sign number 2, selective loss of food-related smells while other categories remain intact. And sign number 1, the nostril asymmetry sign, particularly the peanut butter test, where the left nostril detects smell at a significantly greater distance than the right. Each of these is your brain reaching through your nose and asking for help. Today, you finally know how to answer. Here is my challenge to you. Tonight, do the peanut butter test, and tomorrow morning, start the olfactory training with 4 distinct smells. Do this for 30 days. Notice what changes. Notice what improves. Your brain has a remarkable capacity for recovery when it is given the right conditions. Think about James in Chicago, still fishing with his son. Think about Margaret in Philadelphia, still teaching Sunday school. Early detection changed their trajectories entirely. It can change yours too. If this video helped you today, please hit that like button right now. Subscribe to this channel so you never miss the honest, practical health information we put out every week for adults over 60. And please, share this video. Send it to someone you love, a parent, a sibling, a friend who has mentioned that food just does not taste right anymore. A simple share could be the most important thing you do for them today. And now I genuinely want to hear from you. Have you noticed any of these signs in yourself or someone you love? Which sign was the most surprising to you today? Share your answer in the comments below. I read every single one, because remember this: aging does not take away your brain's ability to protect itself. It simply reminds you to listen more closely to the signals it is sending. Your nose has been trying to tell you something. Now you know how to listen. Take care of yourself.